Hello, and welcome to your session describing how we can address the needs of adolescents and young adults affected by cancer through physical activity. My name is Amanda Wurz, and I hold a PhD in health and exercise psychology, and I'm a certified personal trainer and yoga instructor. After listening to this presentation, I'm hoping you'll walk away from your computer being able to recognize what makes adolescents and young adults affected by cancer a unique population, being able to explain what we know about physical activity and tailoring for this population, and having a better understanding of what our lab is doing to promote physical activity and ultimately wellness among adolescents and young adults affected by cancer. Adolescents and young adults affected by cancer represent a very small population in cancer care, comprising about 2 to 5% of all new diagnoses each year. As well, adolescents and young adults affected by cancer are recognized as a distinct group. As you know, if you're an adolescent or young adult affected by cancer yourself, or as you might be able to imagine if you are between the ages of 15 to 39 years, or even thinking back to this time, being diagnosed with a chronic disease, undergoing intense treatment regimens, and being confronted with your mortality during a time when you're defining yourself, establishing your friends and romantic relationships, starting your career, and seeking financial independence can have tremendous implications. And we know that because of this, adolescents and young adults affected by cancer experience a greater symptom burden than older adults diagnosed with the same cancer. But also, many experience positive outcomes and are incredibly resilient. Supportive care services can include things like support groups, programs, and resources are really important to address the burden of cancer while also continuing to promote these positive outcomes. Unfortunately, when we look to the literature and practice, we see that very few supportive care services exist specifically for adolescents and young adults affected by cancer, which is an important gap since we just learned that this is a unique population. So physical activity or movement is one strategy that might be able to address this gap. So physical activity can include things like walking, swimming, lifting weights, etc. And we know from research that physical activity is safe, it's feasible, and it's doable for people affected by cancer. We also know that physical activity can promote a range of positive outcomes in areas spanning physical, so this could include things like improving physical fitness, body composition, and cardiopulmonary functioning. Physical activity can also enhance psychological outcomes, improving mood, quality of life, and body image, and decreasing feelings of stress, anxiety, and depression. Physical activity can promote social outcomes, particularly when it's performed with a partner in a group setting, by helping people feel connected to similar others. And physical activity can promote cognitive outcomes by promoting blood flow, neural activity, and structural changes in the brain that may enhance individuals' ability to think, focus, remember, follow directions, and carry out plans, helping them with decision-making, organizing, and remembering things more effectively. Yet much of this evidence and work has been conducted with middle and older age adults affected by cancer. Considerably fewer physical activity studies have been conducted with adolescents and young adults affected by cancer. In the research that has been done, similar benefits have been reported, with researchers finding that physical activity can enhance or promote a range of physical, psychological, social, and cognitive benefits. We also know from this research that adolescents and young adults affected by cancer have different preferences for and experiences with physical activity. Yoga is another strategy that we might be able to use to address this gap in supportive care services. Yoga is one type of physical activity or movement that typically includes meditation and relaxation techniques, breath practices, and physical postures. Similar to physical activity, yoga is a strategy that has evidence to support a range of positive outcomes. So yoga may enhance physical functioning by improving things like flexibility and range of motion. It can enhance psychosocial outcomes, which includes reductions in symptoms of anxiety, depression, and negative mood. It can promote a greater sense of spiritual well-being and overall quality of life. As well, we have early evidence suggesting that yoga might reduce symptoms of fatigue. And there's evidence that yoga may offer similar benefits for adolescents and young adults affected by cancer. Taken together, we know that physical activity and yoga can promote a range of positive outcomes. We also know that adolescents and young adults report a desire to access physical activity and yoga programs as a means of managing and enhancing their health. Yet very few physical activity and yoga programs have been developed with and for adolescents and young adults affected by cancer. And as we already discussed, few studies have been conducted exploring physical activity and yoga for this group. We also know that adolescents and young adults are a distinct and unique population, and researchers have found that this group want different types of programs and services. Specifically, adolescents and young adults want support to increase their activity or movement levels, and they're interested in engaging in physical activity interventions that are supervised and home-based. We know that adolescents and young adults affected by cancer want programs that are restricted by age to ensure that they're participating with similar others, and they want opportunities that include strength training, aerobic activity, and flexibility exercise. As well, this group want interventions that are convenient and that take into account their multiple competing needs and obligations, so managing their work, family, social life, as well as their desire to have enhanced movement. And we know that this group really wants programs that provide opportunities for them to connect and experience being supported socially. Moving online and offering physical activity and yoga virtually is one way to potentially address these desires and ensure we're offering movement in a way that adolescents and young adults want. Recent evidence suggests that online interventions may be an optimal intervention modality for this cohort. Notably, online interventions also address many of the barriers that are typically reported when trying to develop physical activity or yoga programs for this group. This includes adolescents and young adults who are affected by cancer being a small and spread out population. As you can likely imagine then, running group-based yoga programs or recruiting enough participants to draw meaningful conclusions from physical activity interventions can be really challenging at any one physical site. Going online can open up our capacity and ability to offer physical activity and yoga to this small spread out group, who until recently have received very little research attention and are only just beginning to get age-appropriate supportive care opportunities. In addition, offering physical activity and yoga online can address a range of other barriers we see to movement, which includes issues with travel time and access to trained personnel. Our lab has developed or is involved with 3 different movement programs for adolescents and young adults affected by cancer. The first is through Wellspring, the young adult exercise class, which is offered to young adults aged 18 to 39 years. Participants are offered an online, group-based, 45-minute circuit-style class that includes aerobic, strength, balance, and core exercises 1 time a week. This class is led by instructors from our own health and wellness lab. You can scan the QR code at the bottom left-hand corner of this slide if you're interested in learning more about this program. Our second program that offers physical activity as a supportive care service, particularly to adolescents, is our IMPACT program. And this was designed and developed to be offered to youth, so individuals aged 5 to 18 years old, with any cancer or blood disease diagnosis, who are currently receiving or scheduled to receive treatment, or who have completed treatment less than 3 months and who live in Alberta. Participants are offered online one-on-one physical activity sessions led by a qualified exercise professional 2 to 3 times per week for 15 to 45-minute sessions over an 8 to 12-week period. This is a study program, which means we'll also be assessing outcomes in order to generate important data related to the effects of physical activity for this population and to better understand how we can continue offering such programming. Once more, if you're interested in learning more about our IMPACT program, you can scan the QR code at the bottom left-hand corner. Our third program is our Yoga for Young Adults Affected by Cancer program. This program was started formally September 2020 and was offered to young adults from across Canada who are diagnosed with cancer between 18 to 39 years of age and who are currently 18 years of age or older. Our yoga program is comprised of 8 weekly classes that are 1 hour in length. Each class includes meditation and relaxation, breath practices, physical postures, and behavior change techniques. The first 45 minutes of each class are comprised of gentle, progressive, hatha-based yoga sequencing and postures. The last 15 minutes of class are focused on guided behavior change and mindfulness techniques that vary from week to week. Generally speaking, these final 15 minutes are focused on fostering social support amongst program participants and teaching and empowering participants with techniques to practice yoga, meditation, and mindfulness on their own outside of class. Our class sizes were kept at 25 participants to ensure safety and effective delivery of the program, as well as to help us build a sense of community. The instructors leading the classes have similar training backgrounds, having completed at least a 200-hour yoga teacher training, our Yoga Thrive teacher training certification, or a similar training, and having experience or practical experience working with individuals affected by cancer. Importantly, these classes are also moderated for safety to enhance engagement by 2 volunteers. We conducted a quality improvement cycle on this program, and preliminary analyses are suggesting that we've had just over 100 people from across Canada participate. 30% have opted into a study where we're collecting pre, post, and follow-up data. We did conduct some qualitative interviews, and findings from this have provided us with early acceptability and satisfaction information. So we know from this data that we're filling an important gap in care, and that in general, this yoga program is being well received. However, we also learned that to optimize this yoga program, we should be offering it over a longer period of time, beyond 8 weeks, providing participants the chance to practice more than 1 time a week. Therefore, we're revising our original program to offer yoga for young adults affected by cancer version 2, or revised, and we'll be starting this fall 2021. Participants will still be adults who are 18 years of age or older, diagnosed with cancer between the ages of 18 to 39. But incorporating feedback from this last quality improvement cycle, we'll adapt it to be a 12-week program with classes offered 2 times per week. We'll also change this program to be a study program. So this means when individuals sign up for the yoga program, they'll also sign up for the study. And this is important and similar to Impact, as it will allow us to generate the data needed to argue for the importance of yoga for young adults affected by cancer. In wrapping up, the take-home messages from my session are that adolescents and young adults are a unique population in cancer care who warrant tailored and targeted interventions and programs. Physical activity and yoga are safe and beneficial for adolescents and young adults affected by cancer. However, more research and programs are still needed to generate population-specific evidence and to help us increase opportunities. We are seeking to address this gap by offering and studying physical activity and yoga online to enhance accessibility and meet the needs of adolescents and young adults affected by cancer. In closing, I'd like to acknowledge the support for the projects I described herein, from the Health and Wellness Lab, from our yoga instructors, our student moderators, our qualified exercise professionals, and Dr. Koulos Reed's Excel project funding, which is supporting 2 of the programs that I shared with you today. I would also like to thank all of the participants who've given of their time to take part in the programs that I described. And I'd like to thank you for joining us for our education series. I hope you're enjoying the other sessions, and please feel free to contact us if you have any questions.